that's a really good question. I think it gets tangled up a little bit, but exercise, let's just approach that one because that's what we're really talking about here. Is exercise is important not just during survivorship, but also during treatment. I can remember years ago when I started, back in 2004, we had advice from our physicians telling patients to just sit down and take it easy. And that has really changed over the last 5 to 10 years. So during treatment, it's important, exercise is important simply because it helps to manage nausea, fatigue, constipation, and I think one of the most medically unrecognized issues that it addresses is body image. Because when we exercise, our body and our minds begin to work in unison much better for a much better outcome for patients. They just become more aware of the body that they inhabit. So it's important in that respect. So in survivorship, exercise addresses many issues. It addresses the fatigue, the nausea also, if there's any underlying and ongoing problems, but it also addresses weight management. Exercise does not necessarily lead to weight loss, but it helps us to manage the weight at which we have attained. It also addresses bone health for women or other patients who have had a loss of bones, or they're taking a medication that helps, that takes away their bone density. It addresses muscle mass, which helps keep their bodies at the right body weight. It's the body image. There's just so many things about it. I think that it's beginning to be used as exercise as medicine when oncologists are talking to their patients. I hear it more and more, and I read it more and more in a physician's documentation, and I'm really, really pleased with that.